Hi, this is Dr. Darnese, America's Life Coach and the founder of the Quest for Meaning Institute, where I help women with all kinds of issues. Mainly, my passion is to help women know, love, and value ourselves. And welcome to my lifestyle channel. Thanks for tuning in. What I want to cover here in this video is one of the aspects of life that as women we don't necessarily um, prioritize, and that is our self-care, our health. And I wanted to come on and talk about something that so many women struggle with. And it dawned on me to make a video because I'm writing a book called 40 Something, A Most Radical Decade of How I Came to Know, Value, and Love Myself. And it's a spiritual memoir. And I got to a place where I was writing about self-care and how as women we often prioritize other people ahead of ourselves, and we're really nurtured and socialized that way. So that's the behavior we take on, is prioritizing other people's well-being over our own. And particularly for Black women, we are, carrying that, I guess, stereotype as well as role of being a superwoman, always being strong and, you know, just not allowing ourselves to relax or, anything that would be perceived as being weak. So that means that we really drive ourselves, we push ourselves, we don't take care of ourselves as much as we should. So as I'm writing this part of the book, 40 something, and if you want to get a free excerpt of the book, I have a link in the details below. You'll be able to go to that link, 40somethingthemovement.com, and get a free excerpt from the book. But anyway, when I came to this part of the book, writing about myself and writing for other women, it dawned on me that I should make a video, put it out, because so many women are suffering with fibroids. I wrote about my own situation having fibroids, and so many women struggle. I mean, it's like an epidemic, really, and it's astounding that the medical professionals really can't even tell us exactly what's the cause or really what's the cure. So women are struggling with fibroids, and I guess I'll say we're it's a disorder that leaves us with chronic, extensive bleeding and pain. And for most of us, we just live with it until we can't live with it anymore. And so, women I know are, trying natural remedies as much as they can. And the internet is full of those kind of things. If something like that works for you, more power to you. But for me, I made a choice to do surgical procedures, and those worked. I mean, I can say those worked, even though I had to have another one. I had one, and then I had to have another one some years after that first one. But they've worked, for me. And so I wanted to come on and share about that because I know a lot of women are afraid to have the surgery. Um, if women are afraid that they will have to, some doctor will tell them that they have to have a hysterectomy and have the fibroids out. Um, so I just want to say there are options. You don't have to have a full hysterectomy. You can have the fibroids removed without having your whole uterus removed in some cases. I'm not a medical doctor, so I'm not giving you medical advice here. I have a doctorate, a PhD, and I'm a college professor, but I'm not a medical professional. I am here to share with you my personal experience with fibroids, and say that to my sisters, you do not have to just struggle with this bleeding that leaves you depleted, exhausted, anemic, cranky. It just saps the life out of you when you're bleeding that much. And, I remember I used to bleed like maybe 12 days at a time, and then it would stop, and then it would come back. There was just no predictability, which means it takes a lot of spontaneity out of life. You can't just pick up and decide you're going to do something. You're always worried. Am I going to start bleeding? Am I going to start bleeding? because you don't know. Your period is completely off. It doesn't really have anything to do with your actual menstrual cycle. You're just having bleeding because you've got these masses of, growth inside and around your uterus, and the body is going through what it goes through to try to, I guess, release them. And so it means that you're bleeding for long periods of time, month after month. Of course, you're going to be anemic. And, many of us have had different experiences of, um, having to carry extra stuff, extra underwear, extra clothes, pads, tampons, everything. I used to carry so much stuff, and I'd be paranoid. I was always paranoid. So when I hear about my sisters, not complaining about pain, yeah, but suffering with something, and women will talk about these things in hair salons and bathrooms, because it's so common, just extraordinarily common. I always say, girl, you can go to the doctor and have a treatment. So the first thing I had was a myomectomy, and that's a surgery where they just go in and cut out the fibroid growths themselves. Not your uterus, not a hysterectomy. It's a myomectomy, and a myomectomy is where they cut out the fibroids themselves, leaving everything else intact. So that's the first surgery I had, and it did involve an actual incision through my abdomen. And because the doctor I was living in Oakland at the time, Oakland, California, and I had a really good doctor who was, kind of staying on top of things in terms of latest research and technique, because he used some sort of apparatus. I don't even know what it was, what it is now, but the incision was much smaller than what's usually given as the incision, and so I think maybe it was 3 inches or so of an incision to go in and remove them. And it turns out I had many more than what they had anticipated. But and he showed me pictured Polaroids afterwards. It was pretty gross. It looked like balls of, you know, fat from a chicken or something like that. It was really, gross to see. But and that was even after, in preparation for that surgery, I had been given this drug called I'll think of it in a moment. That was intended to shrink the fibroids before the surgery, to make it easier, less bloody, apparently. But anyway, that was the first one. And then secondly, some years later, well, let me just say, because I can see now I need to make more than one video and be, you know, more specific about each specific thing. So let's just consider this the overview video. After that first myomectomy, I did, in fact, I felt a heck of a lot better. It took probably, I think I was off work at that time for maybe 6 to 8 weeks following that surgery. And I felt a whole lot better. I mean, I really did. But it did take some time to, get the groove back. And for years, I was good. I had a regular period. I didn't have crazy cramps. I mean, I really was relieved, and it worked really well for me. And then, I guess maybe 10 years later, or close to it, maybe not even, maybe like 8 years or so, they came back. And my original doctor did tell me that, as long as a woman is in her fertile years, it's likely that fibroids will come back. And, they're benign, they're not cancerous, but they're these masses of tissue that accumulate. And anyway, he had told me that they may come back. And so some years later, they did. And then the second time I had what's called a uterine artery embolization. It was not a surgery where they go in through an incision. It was through an embolization method, which is, through the groin area with a tube, which is, about the width of my finger, or probably even thinner than my finger. And they would go in that way and embolize, or I guess kind of, I almost want to say cook the arteries leading from the uterus to the fibroid. So if you think about there being an artery, through which the fibroid grows, receives blood and grows, they do something to this artery, so that the fibroid shrinks. And that was the second treatment that I had. I moved to Southern California, living in Los Angeles, and I had a good doctor again for that procedure. And so that's been some years ago, and that worked. And so when I say to women, you don't have to suffer. There are other options rather than just a hysterectomy, which freaks everybody out. Understandably so. I mean, no woman wants to lose her uterus. We don't want to lose our body parts. Even though people say, oh, well, you're older now, you're not going to have children, or you already had your children. It's still my body, and I don't want parts removed unnecessarily when there's another option. And there are other options, ladies. So, you know what? I just want to let you know, take care of yourself. You have to prioritize yourself. And something like fibroids, where it is like slowly sapping your energy and your quality of life, I don't want that for you. And I'm someone who went through 2 procedures, and I can tell you, the actual procedures, the recovery time, I can tell you more about that if you want to know more about that. Leave me a comment, and I'll certainly answer, what I can. But, it was well worth it, getting back my life, getting back spontaneity, not having to worry about, am I going to bleed? I can wear white. You're a woman who's suffering with fibroids. The last thing you want to do is wear white, right? It's so unpredictable. Anyway, I'm going to call this the overview video, how to treat fibroids, the overview with Dr. Darnese, because I'm going to come back and, kind of walk more slowly and with more detail around each of those procedures, the myomectomy and then the embolization procedure that I had secondly. And, some things that you could talk to your doctor about, because as I think about it too, what was hard about those procedures were the medications that they gave me afterwards, just pain relief and all that kind of stuff. So I'm going to wrap up this one and look for some other videos from me about fibroids. All right, so bye for now.